You guys know these, like when you used to French cuff your jeans and you like tighten the bottom and roll them up, or when you'd have like Van Dutch hats or Von Dutch hats and things like that, or bell-bottom jeans, depending on what generation you're from. All these fashion trends were really like, I don't know, they were sort of a dynasty. They had their 4 or 5 years of fame. When you have fashion trends, I mean, it kind of makes sense. Things go into style, things go out of style. It's okay. But what happens when that's part of your body? Because it's easy enough to change your shirt or change your jeans, but when it's your body, you've got to take a second look at things. So stay tuned for the top 5 most fashion cringe-worthy procedures. Hi, I'm Dr. Jonathan Zelkin, a board-certified plastic surgeon in Newport Beach, California. And lately, I've been sort of taking an inventory of certain procedures that patients kind of come back in, and I'm seeing patterns towards a desire for either some sort of undoing or even reversal. Certain procedures tend to generate more uniformly negative patient experiences. Okay, so starting with number 1. This is a favorite operation of mine, and if you've been in my practice, we've talked about it. I even have videos on YouTube about it because it's a great procedure. It's called a lip lift. Number 1, cringeworthy procedure is the lip lift surgery. It is a wonderful operation. The bullhorn lip lift, the corner lip lift, all of these have a special home in my plastic surgery practice. This is a very, very popular procedure. A lot of women are asking me for it because certain fashion models or other celebrities that they know have had it done. And the operation is simple. You cut skin from the base of the nose and you pull the lip up. If you see my own videos, you'll understand that this operation is a brilliant one. And the idea is to provide a pout when you have an excessively long or ill-defined upper lip. But when you are upsetting certain facial harmonies, like for example in me, my lips are already too close to my nose. If I were to try to raise my lip up to show my teeth, I would create an unnatural appearance, and therefore I am not the right candidate. A lot of people understand that this is a relatively straightforward procedure that could be done under local anesthesia, so it seems very desirable. However, be forewarned, I've had at least a dozen patients in my clinic asking for some sort of operation to correct or undo this procedure. This is not an easy procedure to reverse, so the lip lift has to be very carefully deliberated prior to moving forward. It's a trend right now to do this, and you need an artistic plastic surgeon to say no if you're not a candidate for it. Patients who are great candidates for this procedure, once again, are those with an excessively long upper lip, a mouth that is about 50% of the distance between the nose and the chin or lower, lack of filtral column definition, and patients, especially women who just can't see their upper teeth. It's unattractive and you want to create more of a pout. These are the right patients. Number 2, jawline filler. This is something that's been very popular for the last, I don't know, 5 to 10 years, putting as many as 10 syringes in your jawline to create that snatched sort of Kardashian sort of really exaggerated chin look. It's very popular in men, it's very popular in women, and it's fillers. We even offer it in our practice. We love it, it's a great procedure, but jawline fillers is not a solution to everything. And so when you're adding a significant amount of volume to the jawline, just remember, it is inherently making a feminine face less feminine. And this is a temporary procedure, you can always reverse it, is not always true. There are so many important nerves and arteries and veins along this region that sometimes you can create injury to both sensation of the lower lip or even movement of the lower lip. You can cause what we call occlusions of arteries, and you can actually cause tissue loss. This is not a benign procedure, it is not inexpensive, and it's not completely reversible because a lot of times scar will replace the filler that was there, and after years of putting filler and filler and filler in there, you can't always undo the appearance of an overfilled jaw. So before you go out and you spend $10,000 on 7 syringes of filler, just be aware that there may be smarter options and to be more open-minded to other procedures to enhance your jawline reversibly. Number 3, the Brazilian butt lift, the BBL. I've always taken a little bit of issue to the term Brazilian butt lift, and I think Fat transfer to the buttocks is a beautiful procedure when it's done tastefully. But when we overdo it, it's very common to create this shelf-like appearance that's overfilled on top, and it gives you this, I don't know, unnatural appearance that everybody can probably recognize from a mile away. I have read more and more articles and seen more and more patients, women almost exclusively, who at one point wanted nothing more than that Kardashian butt. But now, especially as the Kardashians and Jenners are undoing their butts, everybody wants it undone. And lo and behold, it's not as easy to do as we once thought, because we have stretched out the skin. We have already spent those dollars for the procedure. And in some very unfortunate cases, we've caused injury to the soft tissue envelope already, or even worse, a lot of patients have died at the hands of the surgeons performing these procedures. For carefully selected patients who truly are top heavy and lack definition and fullness of the buttocks, fat transfer to this region is a very attractive way of restoring some semblance of femininity and an S-curve to the lower back and buttocks. However, when it's done excessively, it doesn't look right, and as we are seeing, it is nothing more than a trend. So be very careful when you are about to embark on your journey to get a BBL that many patients remain unhappy, that travel to foreign countries is risky and scary and you're alone, and that even if you do it here in the US, the operation is not designed to give you timeless beauty. This is a trend that you have to be aware of. Number 4, the Barbie nose. So I don't know if it's called a Barbie nose. I don't know if it's the ski slope. I'm not too sure what it is, but ever since maybe 2017, I've been getting an uptick in requests for a very small upturned nose. This is a style that I thought was fashionable in the 80s, that sort of tiny tipped pug nose type thing that really fell out of fashion for about a decade as we started to learn that the long-term results of resecting or over sculpting a nose are almost never attractive. So it was really popular, again, 5 years ago and forward, to get this sort of Turkish nose that's really pinched at the tip, upturned, a nice little ski slope, very feminine, paired with a lip lift to give you that pout. This was the Instagram face, the Instagram nose. And I say was because nowadays we're starting to have more respect for individual and ethnic identity and trying to really appreciate and take ownership of the noses that we were blessed with. I've disappointed some patients because I don't offer these procedures to really shrink a nose and upturn the nose. I was trained to create a nose that is designed to last decades. And by creating an over-resected appearance and a pug nose, you will almost invariably create long-term compromise of form and function. And so the Barbie nose is a procedure that I'm happy to turn patients away for, especially if we have any suspicion or inkling that this is linked to social media phenomena. We all want that sort of pinched, selfie snatched look with over-contoured noses and that cute little tip that's broken. In real life, these patients, these models that are doing this, probably don't look like they do on a filtered image. And I just want patients to be very aware that creating that look IRL may lead to downstream disappointment. So that's number 4. Number 5, oh my gosh, the cat-eye thread lift. Again, this is a procedure that I've tried to improve surgically. The cat-eye thread lift or the cat-eye look, anything cat-eye, is something that a lot of patients ask me for, and frankly, I'm happy to do it. But to overturn, to overcorrect, and especially to do so with threads, usually leads to disappointment. So the cat-eye thread lift is something that I performed as recently as 2 weeks ago. I love the procedure. I call it canthopexy. Essentially what I'm doing is I'm taking the tendons that attach the corner of your eye to the eye socket, and I'm moving it up. I'm taking it from maybe the 8 or 9 o'clock position to the 9 or 10 o'clock position to give you a little bit of a canthal tilt. That is a very rejuvenating, feminine, attractive procedure that allows people to look more like celebrities that they want to emulate. It's a very not only trendy thing, but I think it does create some timeless beauty as well when it's not overcorrected. See, that's the problem. The cat-eye thread lift is not just a canthoplasty, I'm discovering, and it's not always correctable. Fortunately, thread lifts are very transient, and usually after 2 to 3 weeks, a lot of patients think that this goes away. So the dents and the ripples and the wrinkles that you're seeing in all these sort of scary looking graphics and warnings for befores and afters typically will be self-corrected after a certain period of time. Just be warned that these are just fads. Find a plastic surgeon who is very wary of overcorrecting a beautiful face for fear of creating irreversible change in the long term. I am committed to helping patients achieve their goals within certain limits and having certain realistic expectations, and I will be the first person to warn you when something's overdoing it. Notice I'm a plastic surgeon who has very little hesitation to perform buccal fat pad surgery, which I don't think falls on this list. I don't think facelift falls on this list. I think operations designed to enhance natural beauty do just that. However, when you're trying to create something that's unnatural for the sake of emulating a filtered image or a celebrity that you admire, you can run into problems. I hope this video helps. Feel free to ask comments and questions below. This is a very hot topic, and I just want you to watch this before you embark on your own consultation and plastic surgery journey. Thank you so much for watching this film. Make sure to subscribe and click that little notifications button if you want to be appraised of any future videos that come out on my channel.